Welcome to More Smiles Dental Podcast, Season 1, Episode 3. As I mentioned in the introductory reel, this episode was to be about pediatric obstructive sleep apnea. However, even though I put out multiple feelers to physicians who are supposedly certified in diagnosing and perhaps treating obstructive sleep apnea in children, I didn't get a lot of answers except for one who responded. This has been a problem in the New Orleans area, getting a child diagnosed and treated for obstructive sleep apnea. There are many causes, and there are just as many treatments. I will discuss this more in episode 4, but I'll become an advocate for the children in our community to see if I can help solve these problems. In the meantime, I have stories for you. I explained to you in episode 1 the problems with obstructive sleep apnea on your entire body, your emotions, your intellect, your memory. But two stories came to light very recently. The first one is a lady who was Administrator of the Year in the American Academy of Dental Office Managers. My wife, Julie, who's our practice administrator, is a master in the American Academy of Dental Office Managers and was twice the Administrator of the Year Special Recognition Award winner. Well, the lady who shared this story with me has quite a history. For 5 years, she has had multiple surgeries. She has had 12 eye surgeries. She's had congestive heart failure. She's had 2 heart surgeries. She's had multiple episodes of extreme oxygen depletion and what we call desaturation that led her to hospitalization over and over and over again. In the meantime, she was trying to manage her husband's dental practice. It has been quite a burden for her. Finally, at some point, she mentioned that she just didn't sleep well. And one of the physicians said, well, I wonder if you have a sleep breathing disorder. She goes, what is that? And she goes, it's obstructive sleep apnea, where you snore and stop breathing at night. They ran a simple level 2 test at home, not even a polysomnogram in the hospital. And what they found out was she had severe sleep apnea. Well, when you have sleep apnea, as I pointed out in the other episodes, you deplete your oxygen. Your brain is depleted of oxygen, so is your optic lobe, and damage occurs to the blood vessels in the eye. Also, the heart muscles are stressed out. You produce cortisol, which is a stress hormone, and you gain more weight due to ghrelin being produced. She kept gaining weight, and she didn't know why. And her conditions, both of them, the eyes, the heart, just kept getting worse. Well, after she was treated with a CPAP, because she was in a severe situation, so an oral appliance was not indicated in this case, although it could have been used, it was not the first choice because she was severe. In mild and moderate cases, an oral appliance will get the same cardiovascular, cognitive, and daytime sleepiness improvements as a CPAP. But once she was on a CPAP, her symptoms went away. Now, why didn't the physicians rule out a sleep breathing disorder? Well, no one asked her. And in our office, More Smiles Dental Spa, we ask every patient, how are you breathing? And as I'm going to talk about, hopefully, in episode 4, we ask parents whose children are on ADD, ADHD medications, do they snore? Do they sleep well? How do they act during the day? It is a real tragedy that something that takes up usually almost 1/3 of our life and is so necessary, as I pointed out in the last episode, to rejuvenation of cell structure, of healing, that's ignored and not even thought of by physicians. And we have cardiologists in this area that go right to that. They routinely run a sleep test. Another story I have is a patient who I know very well. She goes to the same cardiometabolic prevention nurse practitioner that I go to, who is certified in the Bale-Donine method of cardiometabolic prevention. I mentioned to you the book Beat the Heart Attack Gene, written by Amy Donine and Dr. Bale. And in her blood work, which she gets done like I do twice a year, and it goes to Cleveland and Boston clinics, our urine analysis goes there also. The nurse practitioner was looking over the numbers and called her up and said, "Do you have sleep apnea?" And she goes, "I'm not sure what that is, but what do you mean?" She goes, "Do you snore at night or stop breathing?" She goes, "Well, my husband says I do." And she goes, how would you know that? How would you ask the question? She goes, "Well, some of your heart muscle enzymes are being released, and that's damage from sleep apnea." Sure enough, she had 2 tests done, and they both showed that she had moderate sleep apnea. She was treated with an oral appliance and retested 6 months later, and her numbers improved overwhelmingly. These stories are sad that that physicians don't think about that right away. However, I guess the good news is in the second story, the clinician, the nurse practitioner, Deidre Detrez out of Lafayette, Louisiana, who treats me as well, picked up on it right away from the blood work. Now, she had seen blood work before, and these signs weren't there, so when it popped up, she was very, very intrigued. I am begging you that if you have any type of medical condition, even one that doesn't seem like it would be related to obstructive sleep apnea, connective tissue disorders or anything, but especially cardiovascular, emotional, disabilities or in learning or staying awake, think about your sleep. Get a sleep test. I do have multiple physicians that I work with that I can refer you to. Having said that, I have a level 2 sleep test here in the practice. For just a screening, I charge $95. If I'm having a physician read it and a certified respiratory therapist read it, I charge $300. Now, insurance will usually not reimburse for that, but it's a good way of knowing whether or not you really do need it. And then I turn those results over to a physician who can write a prescription for an oral appliance or for a CPAP. I'd like to go into now the different possible treatments for obstructive sleep apnea. And these can be combined quite often, and they can all be effective if they're applied correctly. All of them have failures, and even when they seem like they should work. Now, let's discuss reasons for failure. Number 1, patient compliance. You don't wear a CPAP, you don't wear an oral appliance, it's not going to heal. Number 2, sometimes the body just fools us. You can have the Inspire done, where they put an electrode up into your neck to push your tongue out of the way when you stop breathing. And sometimes it just doesn't work. There are surgeries that happen, and they work great majority of the time when they're indicated to be done. But some of them, even like UPPP, where they remove your soft palate, for the most of your soft palate, that has a 65% failure rate after 5 years. So you have to look at the entire condition of what's going on with the patient. So let's talk about it. Let's say you're diagnosed with obstructive sleep apnea with no insomnia. Insomnia is the number 1 sleep disorder. That's a neurological issue. I don't treat that. I just work with, I can give some advice, but I'm not the go-to person. And I might mention that in another podcast. But let's say you have a sleep test done, and it shows you have mild, moderate, or severe. And we discussed that last time, where for 50 years now, we've used the average of snoring 5 times a hour as normal. 5 to 15 times mild, 15 to 30 moderate, and 30 and above severe. And it seems to have worked very well for us to use those parameters. But more importantly is oxygen desaturation. Okay, so let's say you're diagnosed with obstructive sleep apnea and it is severe. Well, we have to see what's going on. I am a big proponent of CBCT scans. Those are computerized tomographs that physicians rather should send them to me and have the x-rays done. Very low power, very minimal x-rays, and literally 1/5 the radiation that a pilot in a commercial jet gets flying from New Jersey to San Francisco. Exact same radiation and 1/5 of it. And you know that pilots fly back and forth all the time. So with a CT scan and with a direct physical exam of the oral cavity and the oral pharynx and the nasal passages, you can see if a patient may fail at CPAP, may fail at an oral appliance, may fail at Inspire, may need or not need some oral surgery or ENT surgery to repair something and improve it. So let's just break it down. Say we decide we are going to use a CPAP for some reason. Well, how a CPAP works is it pushes air through your nose into the flexible tube of your neck and pops it open and increases the pressure necessary to close it. So if you have a lot of cricomental space here, that's the cricomental area in this space here in tongue fat, it often works. It pushes air in. Now, a lot of people fail because they can't breathe through their nose. So in my opinion, I think the nose is ignored a lot. And we're going to talk about nasal breathing in one of the future episodes and why it's important to you and why it's just a great benefit. But if a CPAP works, it works very well. And it's very predictable because it pushes air in. Now, people can't tolerate it, like I said, because they can't breathe through their nose or because it's just they have skin cancer, or it messes up their hair, or their husband doesn't like it, or whatever. But it's an excellent and very effective appliance. Does it have a high failure rate? Yes. The main reason is people don't want to use them. They consider them horrible. They feel like they're being waterboarded if the humidifier is on or too much pressure. And I can understand that. I own a CPAP and I use it when I go to altitude to visit friends that are high altitude, but I myself have had obstructive sleep apnea 3 times, and I'm going to explain that to you in a moment when I discuss some of the options about being treated. Oral appliances. As I explained to you, the oral appliance pulls the jaw forward just like when you're doing rescue breathing on somebody during CPR, and opens up the airway laterally, anterior, posteriorly, of course, and vertically, and it allows air in. Well, it doesn't sound as good as air being pushed in, but actually on mild to moderate cases, as I mentioned earlier, it's equal cognitive, cardiovascular, and daytime sleepiness of benefits. Also, it's not as awkward to wear, but there are restrictions to it. Just like the CPAP doesn't work well with nose problems, poor nose anatomy. The oral appliance has to have a certain number of teeth. It can be no gum disease. We have to look at tongue space and other things. TMJ problems are usually not a problem for it. In fact, sometimes it actually improves the situation. So it's not a contraindication if your jaws are clicking and popping or you have some TMJ pain, because 70% of the time, myofascial pain, so-called TMJ pain, is actually due to you grinding or clenching your teeth, trying to open up your airway because you have sleep apnea. Now, the electronic device Inspire. I've recommended 4 of those in the past year because patients didn't have any teeth and couldn't do implants to hook an appliance onto, or they had gum disease, or they just thought a oral appliance was not for them for some reason. And so I've recommended those. Now, with Inspire that you see on TV, you have to first fit into a certain BMI, that is height to weight ratio, and then you have to have a certain limit on your AHI, your apnea-hypopnea index, which I explained earlier. The FDA has expanded that though, so more and more people are eligible to have Inspire, but it takes two procedures. The first one is a drug-induced sleep endoscopy, where they put you in stage 2 sleep using sedatives, and they put a tube in your nose and they look at your airway and how it collapses. And if it collapses anterior posteriorly and all the other factors are within the parameters, you're a good candidate. But if it collapses concentrically, an oral appliance is actually superior. And at this point, let me mention to you that oral appliance therapy can be used in combination with a CPAP, with Inspire, to improve its outcome. And in fact, there's at least one insurance company, if not two, that makes you have an oral appliance failure before they're going to recommend Inspire, because it is a surgery. The second surgery, if you are a good candidate for the Inspire, is to put a device inside your chest, about the size of a pacemaker, and then run a wire from it up through your neck into the base of your tongue, so that when you desaturate, you have low oxygen, it moves your tongue forward and then opens up your airway. Is it effective? Yes. Does it have failures? Yes, which is really tragic, because you have a wire in your neck now and something stuck in your chest that's not working. And I have a patient like that who I've done an oral appliance on. He failed the surgery of the Inspire. So Inspire is actually my my last resort short of surgery. And so for that reason, but I have good doctors on this side of the lake and the South Shore that do it for me and for my patients. And I have some good success stories in this practice with Inspire. It's something I don't totally reject. I think it's a good idea when it's applied correctly. Another treatment is throat surgery. If someone has a lot of redundant tissue, we call it, a lot of adenoids, a lot of tonsils, a lot of extra tissue in the area that makes it difficult for air to get through your nose, down from your nasal pharynx, down to your oropharynx, to your hypotharynx, and into your bronchial tubes, excuse me, opening that airway up is a great idea. You don't like me for about 3 weeks, and I didn't do the surgery, but your airway's open, and I've had at least 2 great success stories when I've recommended surgery, and the surgeries were done, and the patient did not need my oral appliance anymore, and not even a CPAP. They lost weight, which we're going to discuss momentarily, mostly because they couldn't eat for about 3 weeks, but they maintained the weight off. Now, I haven't heard from either one of these patients for a few years now, but I did follow them up for about a year, and it was great success. As I mentioned, there was failures with removing some of the soft palate, but we're talking about doing more than that, and it's very effective. Another treatment is that involves surgery is that somebody has an underbite, like a jaw that is truly receded, like a mandible that's too small for the rest of the face. Doing a mandibular maxillary advancement, where they section the jaw at an oblique and extend it forward, and it involves orthodontics also. And you need a team of an orthodontist and a really good surgeon and a general dentist to be involved with it. And you're pulling the jaw forward, and just like an oral appliance, it pulls the tongue forward and improves your airway back there. Now, that has success 70% of the time. What about the other 30% of the people? Well, guess what you do? You make an oral appliance to take it the rest of the way. And then it's almost 100% success rate. You know, and success is like getting it down to the normal 0 to 5 snoring. But some people, if you get them down from severe, like a AHI of 50, and they end up like with a 20, they're doing better. So I've never had to recommend one of those yet, but that's on my that's in my toolbox to have one of my oral surgeons do something like that. The new hot subject now, which can work for some body types, is the GLP-1 inhibitors, the Ozempic group and the Mounjaro group. In fact, Zepbound is basically Mounjaro, and it's been FDA approved as an adjunct for treating obstructive sleep apnea. Now, if you're very, very skinny and have a very low BMI, you're not going to lose weight. Something in your throat is obstructing your sleep airway, or your airway when you're sleeping, rather, and you're not going to lose weight. And then some people are just built to be fluffy. So there's ectomorphs, which are very skinny people, mesomorphs, people with, say, my body type, kind of a middle range, and then endomorphs, people that are just naturally heavier. Now, if the latter two can lose weight, one of the first places you lose weight is in your tongue, in your cricomental space. That opens up your airway. So the last time, 2 years ago, I had sleep apnea, and I found it because I had a sign, just like the other patients and the stories we told. I was fatigued all the time. I'm already on a thyroid medication because I'm turning 71, and that's just the way it goes in life. So I couldn't figure out why I was tired. So I asked my wife if I was snoring, and she goes, no, but by the way, you are heavy. And she knew of me giving a lecture to some physicians, and in the lecture, I showed my CT scan at 237 pounds, and then my CT scan at 210 pounds, and how my airway opened up. So I ran 2 level 2 sleep tests on myself, and sure enough, I was a silent apneic. I had mild sleep apnea, the higher end of mild, almost to a moderate. So knowing that I could lose weight and get rid of it, I didn't make myself an oral appliance. I went to the shelf, dusted off a CPAP that I keep around, and of course I set it myself. I didn't want to bother one of my physician friends, and I called my cardiometabolic preventive nurse practitioner and said, I need some help. I need some Mounjaro. So I spent a lot of money because I'm not pre-diabetic or diabetic. Did it for 3 months, lost 38 pounds, and my sleep apnea is gone. Now, sure enough, I gained 5, 7 pounds back, 8 pounds back. Okay, I'm lying, 10, 12 pounds. Anyway, but I'm going to lose that very much soon. But right now, I'm not snoring, and I don't get fatigued. I do have some insomnia from time to time, but that's it. I've recorded myself, and I'm not snoring. So, and we'll talk about recording. That's a good idea. I'm going to mention that. So I've mentioned the ways of treating sleep breathing disorders. CPAP, an oral appliance, Inspire, third surgery if indicated, jaw surgery if indicated, and possibly if you need to lose weight and you gained weight recently and started snoring with the weight gain, using some of the GLP-1 inhibitors. And a physician will do that for you under a physician's guidance. There are other things that we can talk about, such as lip taping and all, but they're not universally applicable. Nose sprays, which I believe I'd mentioned in another podcast, such as Nasacort generic, and the one we sell here, you can get on Amazon, called Clear. It's an XLEAR. It's a xylitol product. Those can help out a lot. Other nose sprays can too. I'm not a big fan of Afrin, but Flonase works real well. And that's basically treatment for it. There was one thing I wanted to mention. I did have a lady come in one time, and I took a CT for an oral appliance recommended by a physician, and I took a CT scan, and I noticed that her lingual tonsil, which is way down here in the throat, yes, it's a tonsil way down there, was very swollen, and I had never seen that before, all the years of taking CT scans. So I was in a little bit of a panic. So I sent her back to the doctor, happened to be an ENT, who had referred her to me, thinking that she maybe had cancer. Well, he calls me up that day that she went in to see him, and said, cancer? She doesn't have cancer. She needs Tums. I went, Tums? What are you talking about? She goes, he went, she has esophageal reflux disease. She's burping up stomach acid, and it's inflaming her tonsil. And you're right, that is what's blocking her airway. So he put her on Prilosec and Tums. I saw her in church, and she yelled at me from her Sunday school class, I'm not snoring anymore. And I went, good for you. And because she was like determined not to wear a CPAP or get an oral appliance. She was just hard-headed. And it's a good thing she didn't. It's a good thing I took the CT scan and knew to look for problems. Well, her husband was walking down the hallway as I was walking up it and said, and he heard her say that, and he goes, well, she's still snoring, but a lot less. Thank you for the help, Jim. So anyway, you have to get a sleep test. If you feel like you're tired, and I can recommend in the next podcast, I'll show you the Epworth Sleepiness Scale. You can actually do internet search, Epworth Sleepiness Scale. Some doctors like to use a stop bang questionnaire. I think that shows a lot of false positives. I like the Epworth Sleepiness Scale, EPWORTH. Look it up. Do a test on yourself. And if you have a score of 11 or higher, you have a sleep disorder. And witnessed snoring is definite sign that you need to be treated. Now, not every night, and not just some nights, rather. Like you may have an allergy, you may have ate something or drank something too late, or your bed partner may be noisy, or you may not have good sleep hygiene, which I'm going to cover in a second. That's a good idea. But if you're snoring consistently, especially early in the morning when you have that last really hard dream, which is the most dangerous time for sleep apnea, you need to be treated. If you feel bad, if you have heart problems, if you have eye problems, if you have emotional issues, I would see if I'm snoring. Now, if you don't have a bed partner, as we call them, or a grandchild, or a neighbor, or somebody you stayed at camp with, or some other ladies who went on a vacation with, if somebody's not hearing you snoring, but you're not sure, there's an app called Snore Lab that I use. A patient of mine introduced me to one that seems better, but right now Snore Lab is the one I use, SNORELAB. If you can't figure out how to use it, find a 12-year-old in your neighborhood and they'll hook it up for you. If you only do it 3 nights a week, you don't have to pay more money to get the professional version, or whatever they call it. But that is a really good test. Finally, I think I'm going to add here sleep hygiene. So, as I mentioned in the last podcast, if your eyes are rolling in your head while you're watching TV or whatever, go to bed. That's stage 1 sleep. The next thing is temperature. The temperature of the room seems to be best at around 69 degrees. Now, that's an individual thing, but 69 degrees from studies and research seems to be a good temperature. Could be 71, could be 68, I don't know. But it's what helps you sleep better, and you'll figure it out. Also, loose clothing. Sleeping naked would be fine, but that's not good for a home invasion, or if your kids walk in the room. But loose clothing, loose bed sheets. Some people like the weighted blankets. One of my sons loves his, and I'm not sure it would help out for sleep apnea, but it sure helps out for insomnia, according to what I've read. But loose clothing, bed sheets that are not restrictive, unless you like the weighted blanket. White noise, pink noise, brown noise. You can Google that and see the things that just make like ocean sounds, bird sounds, or just a constant hum. They can help you go to sleep. Reading, you should not read on any digital instrument that doesn't have either a white page, like some Kindles do, or has a blockout to get rid of that blue wavelength that comes out. It has a nighttime setting. Both Androids and iPhones do. So it gives the iPhone or the Android kind of an orange look, because the blue wavelength, which you see in the sky above, even with your eyes closed, goes through your eyelids, into your retina, through your optic nerve, and into your pineal gland, and does not allow the production of melatonin. Good point to talk about. Melatonin doesn't make you sleep. Melatonin keeps you asleep. So you don't sleep well if there's a lot of blue light going in. You'll never go to sleep. If you're sitting there reading something with blue light hitting your eyes, you'll never start to doze off, and no melatonin will actually kick in to help you get more and more drowsy. So we discussed temperature, We discussed loose clothing, loose bed sheets, no blue lights from TVs. Turn the TV off. Use a regular paperback book or hard book. When it hits your chest twice, you're asleep. Go to bed. Now, a big point is if you eat or drink like iced tea or caffeine, definitely have to eat. Caffeine shouldn't be had after 1 p.m. anyway. 8's too late is what the expression is. Eating after 8 o'clock, you're going to have a crappy night. It's not on your CPAP or your oral appliance or even on you. It's just going to be, that's the way it's going to be. And you'll have daytime sleepiness the next day. That's fine. You can do that. But noisy ceiling fans, noisy kids, and finally, I am huge into eye masks. They are phenomenal. It's weird. You're in a totally dark room and you put an eye mask on and you sleep better. Does that make sense? Works on flights too, but it does work. I also sell, and you get on Amazon, nasal dilators such as Mute or nose cones. I like Mute myself. And then lip taping is something we can talk about another day. But basically, the basics of sleep hygiene I just mentioned to you: the room temperature, the clothing, the sheets, not eating or drinking too late. You can have water, but if you have a sleep disorder or a bad prostate, you're going to get up and pee. Peeing once a night, that's not so bad. But peeing 6 times a night, you probably have a prostate problem, unless you're female, or you have a sleep breathing disorder, not insomnia. So we covered a lot of subjects tonight. The stories, though, I want you to take them to heart. That sleep apnea is ignored, and being quick to be tested is a smart thing to do. And once again, I do have a sleep test here that I can reasonably get you tested and turn it over to your physician, and with the results, and get you treated. So I know this has been a long podcast, but I hope it gave you a lot of great information. I do have a board certification in dental sleep medicine, and I've had to study a lot of stuff, and I still read a good bit. I'm on forums. I'm on a committee selecting speakers for an international meeting. And I hang out with very smart people. And I'll be at the Louisiana Academy of Sleep Medicine again this year. I will not be speaking this year, which is kind of a relief, because I just wrote some lectures that I had to give a couple of weeks ago, and I kind of need the break. But anyway, hopefully I'll have some more work together in a week or two about pediatric sleep apnea, and that'll be involving your precious children and grandchildren. So anyway, take what I say to heart, and sleep well, because it's important. Have a good night.